Welcome to Focus on Your Health, your radio home for news and stories from Kingman Regional Medical Center, here on the KJazz Radio Network. I'm TG LaFredo, and this week I've hit the road. I'm coming to you from the University of Arizona in Tucson, where my guest is Dr. Keith Boesen, director of the Arizona Poison and Drug Information Center. Hi, Dr. Boesen. Thanks for joining me.
Yes, welcome. Thanks for coming.
Thank you. And this is Poison Central. You get calls from all over Arizona, is that right?
All over Arizona outside of Maricopa County. We actually work with another poison center. There's a Banner Good Samaritan Poison and Drug Information Center in Maricopa County, and they do the 3.5 million people in the greater Phoenix area. And then we take the other 14 counties, which is another 2.5 million people. So we split the state by population.
Okay. And this is sort of like Poison 911.
Yes. So right outside here, we have, at our center, pharmacists answering the phones 24 hours a day, 7 days a week, every day of the year.
Poison control.
Whether it's an emergency or a simple information question, we're always here.
Okay, so not having a lot of pain or discomfort at the site.
Nice. There's usually some autobiographical reason why I want to search up a show. I've deemed this the Creepy Crawlies edition of the show.
It's a great title.
It's very scientific.
Yes, it is.
This for me is, I love to run. And I run up there in the desert, the Mojave Desert, outside of our house. And sometimes I'll have my wife take me way out into the outback and leave me, and then I'll run home. And so I'm in the middle of nowhere. And I don't know, each summer I have a couple of close encounters with rattlesnakes. And the closest encounter I had was I nearly stepped on one. And it doesn't make sense to me to say that it was so bright that I couldn't see him, but that was the case. It was a super bright day. I guess they all are. I couldn't see this rattlesnake, and then suddenly I almost stepped on him. I think maybe he had just eaten possibly an entire semi-truck, because he was about 53 feet long.
As most of the rattlesnake stories start out. Huge snake crossing a 4-lane freeway, head's on one side, tail hasn't even come out the other. Yeah.
You've heard some of these before.
Yes, we've heard these tales before, yeah.
This snake was that big, at least, and he gets bigger every time I tell the story.
They all do, yep.
But it got me to thinking. Here I am, 15 miles outside of town. If this thing bit me, what's going to happen to me, or what are my chances?
Rattlesnake venom is incredibly complex, and even more so, incredibly variable. One of the more common questions we get is, what's going to happen? How much time do I have? Those types of questions. And what we usually tell people, one is every rattlesnake bite, when it occurs, needs to be seen in an emergency room.
Right.
And so if that means you are 2 minutes away from the emergency room, you go in 2 minutes. If you are 2 hours away, then you go in 2 hours. It's always the as soon as possible.
Okay.
Now, as far as what will happen with rattlesnakes, because of that variability in their venom, we have seen snakes bite a human being and nothing happens, meaning they bit you, but they did not inject any venom.
Okay.
To the other extreme, which we have seen people die from a result of a rattlesnake bite.
Mm-hmm.
So from nothing to death is possible. Most people fall in the middle,
okay,
where you can have more immediately kind of a local injury, refer to it. So the way to think about rattlesnake bites is they can cause one of three things primarily. One is local injury. So you get a lot of swelling, you can get some bruising in the area, some blisters, even some necrosis where the skin tissue starts to die. Another part of the venom can cause bleeding problems. So your blood becomes thin is the easiest way to describe it. So you have difficulty clotting. And then a third part, which is a little more rare, but we have seen definitely in Arizona, is a neurologic type symptom where you get these neurotoxicities where your muscles can start to it's called fasciculations, but it's almost, if you looked at it, like a bunch of worms under the skin.
Wow.
And that can lead to breathing problems. Now, with rattlesnakes in the desert in Arizona, you can have any or all of those combination of things. It all depends on the type of snake and where that snake lived that got you.
Okay. You said some of the bites are toxic and some are not. Would I know the difference? Would I be able to feel the difference right away?
No, and that's one of the things that is very difficult in the treatment side of it. So many people would expect if I was bit by a snake, something's going to happen instantly.
Right.
But what we've seen is that the onset, or when the symptoms actually show up, can be delayed even 8 to 12 hours. So when we recommend people go in immediately, that's because we've seen problems within an hour and 12 hours later.
Okay.
And every patient needs to be evaluated during that entire period of time to determine what's happening. Is there truly an envenomation? Was venom truly injected into the body, and do we need to treat it?
And how do you go about testing that? Is it just blood work?
The first thing we're looking for when a patient comes in is the local injury. And if there's a reason to give antivenom because there's a problem with the skin, the swelling, there's evidence of the venom being present, we can give antivenom for that.
Okay.
The other thing that we're looking for is on blood tests. So we're doing a series of blood tests to look for the effects that the venom can cause. So we can't test the body for venom in it, but we can test the body for the effects the venom causes.
Okay.
So that's what we're looking for with the blood test, and we'll monitor that throughout the 12 hours if that's how long we need to observe you.
So the answer seems to be that if that snake had bitten me, it's not as though I'm going to fall over and die right there on the road at that moment.
Ideally not.
Probably not.
Probably not. And actually, odds are absolutely not.
Okay.
Which means if you were out in a remote area, whether in the desert, on the road, is that what we tell people, the best first aid you can have is your car keys and a cell phone.
Right. And I had neither.
So something you might want to keep in mind.
Sure.
Yeah. In that situation, flag down a car. But otherwise, you would call for help, or you would drive to where you can get help. But you would go seek help as soon as possible.
Okay.
And we have had situations, and there was a gentleman, not unlike your story, where this was many years ago, but he was out riding his bike out in one of the Saguaro National Monuments that we have down here, and beautiful backdrop, had a new bike, wanted to get a nice image of it as the sun was setting, and he took a few steps back to get the whole bike in the image, and he felt he got hit with what felt like a 2x4 with 2 nails in it, and he had a rattlesnake bite to the back of his leg. And the first car that drove by was not big enough to put his bike in it.
Yeah.
So he declined.
First thing first, right?
Yes. It was a new bike.
It is a new
wasn't going to leave that behind. The second car that came by, he was no longer up for negotiation. Fortunately, it was a truck and he could throw the bike in the back, but he was ready to go. He was willing to leave his bike at that point. And that was about an hour afterwards that he was having some significant pain and discomfort in the area, and he was not willing to be sitting on the side of the road in a very isolated area for much longer.
Yeah.
So he ended up going into the hospital, and he did well, but it was an event. He had a pretty good amount of swelling that actually went from his leg up into his waist and chest area.
And what kind of recovery time afterward for that sort of bite?
And those kinds of things, we've seen variability in that too. So we've seen people 2 weeks later, it's like it never happened.
Okay.
And then other people 6 months to a year later are still having lingering effects.
Wow.
So when we talk about rattlesnake bites, it's usually a pretty traumatic event.
I bet.
And so when we talk about long-term injury, and I mentioned 6 months to a year, things like loss of range of motion, loss of strength, you can't grip a tennis racket like you used to, or a golf club, or even drinking coffee, you use 2 hands instead of 1 because you just can't make a fist anymore. So these are usually these local injuries. They're pretty significant traumatic events. And so when people go to the hospital and they require treatment, this isn't you get a shot and you go home.
Right.
This is you're admitted to the hospital for anywhere from 3 to 5 days sometimes. You go home and you're continuing to do follow-up at home. You're going to get repeat labs with your primary care doctor to make sure the effects are not coming back. And then there's that certain amount of weeks to months of recovery where physical therapy and those types of things to make sure you maintain your strength.
Can you tell me about the AntiVenom? By the way, it's AntiVenom?
AntiVenom.
Venom.
Yeah. So the easy answer to that, the difference between AntiVenin and AntiVenom is like Kleenex to facial tissue.
Okay.
So AntiVenin is a brand name,
Gotcha.
and AntiVenom is what we would call them all.
Understood.
So
AntiVenom. Yeah, let's talk about that. Where does it come from?
So AntiVenom is it's a biological. We actually it's very interesting how that's made. We don't synthesize it. We don't design it in a lab. We actually take venom from the snake in this case. In this case, we use 4 different kinds of snakes in the United States. We take the venom from those snakes and we inject it. The current antivenom, we use a host animal. The current antivenom uses sheep.
Okay.
So we inject this venom into the host animal. The host animal builds up antibodies to it. We then extract the antibodies, like an immune response. We extract the antibodies from the host animal, clean them up, and then we inject them into humans.
Wow.
One of the basic ideas behind this is if we think of a snake, a rattlesnake, as when they bite you, they inject you with a disease. It'd be like it being injected with the flu immediately. So these antibodies are designed, the animal, that we're borrowing them from an animal, has already built up a response to that. So we've isolated that response, and we're injecting that response into humans to counteract the disease. So the AntiVenom goes around and kind of binds up to all the venom that's circulating around, and then you can clear that. So when we give AntiVenom, we're actually, all the bad effects we see from venom start to disappear because the venom starts to be eaten up by all the AntiVenom.
Gotcha. Is this a really expensive drug to produce?
It's a pretty expensive drug to produce because of how we're doing it. I mean, we're using, it's not petri dishes in a lab.
Right.
These are animals that need to be cared for and fed and well cared for.
Yeah.
But it's also, what makes it also expensive is not just the production of it, but bringing it into the United States and having it in the U.S. There are certain expenses and regulations. For one,
Sure.
it's a biological. This came from another animal. It's treated a little bit differently than your average antibiotic that you would take because more testing is done before the product is sold to within the United States. And then because this is also considered an orphan disease, meaning it affects less than 200,000 people, and in the United States, we think there's about 8,000 rattlesnake bites a year.
Wow. Okay.
So the cost to bring it into the United States, to have it all approved and guaranteed that it's safe and effective, is shared by a relatively small number of people.
Right. And where is this drug being made? You're saying it has to come into the
Yeah,
States?
so in this particular case, this drug that we have now is made actually in Europe.
Okay.
We used to make a lot more antivenoms in the United States, but actually the technology advanced more quickly outside the United States, and they started to develop a better wheel. And so we started to, with other antivenoms, we're looking outside the United States for products that we can bring to the U.S., get them FDA approved, make sure they're safe and effective for human use, and then we can use them.
Time for a quick break. On Focus on Your Health, we'll return with the second half of my conversation with Dr. Keith Boesen in just a moment. This is the K-Jazz Radio Network. And welcome back to Focus on Your Health here on the K-Jazz Radio Network. This week I'm in Tucson at the University of Arizona speaking with Dr. Keith Boesen, Director of the Arizona Poison and Drug Information Center. Our listening area covers high desert, low desert, mountains, Colorado River, so we have this big swath of terrain. How many different kinds of poisonous snakes are we talking about?
Arizona has the largest diversity of rattlesnakes than any other state in the country, which means more different types of rattlesnakes live in Arizona than anywhere else.
As in how many different kinds?
There's estimated to be about 17 to 18 different types or species and subspecies, and there's about 31 to 32 in the United States.
Wow.
So if you think about it, more than half of every kind of rattlesnake can be found in Arizona.
Wow.
Where they live can be very diverse. So there are, from the lowest elevation to the highest mountaintop, there is a snake that can and probably does inhabit that area.
Okay.
So there's almost no real rattlesnake-free zone of Arizona.
Okay.
The diversity is so great, from the bottom of the Grand Canyon to the mountaintops and even the Chiricahua Mountains on the farther end of the state have incredible diversity in snakes. And that's what makes it interesting to treat these patients who are bit by snakes in Arizona, because their venom can be slightly different.
Right.
We know what to expect, but we can't predict anything with each bite from one bite to another. No two bites are really the same.
So what is good basic first aid for a rattlesnake bite?
The simplest thing to do with a rattlesnake bite is do nothing. If you're going to carry anything with you, if you feel the need to have anything to treat a rattlesnake bite, it's your car keys and your cell phone.
Okay.
Anything you have ever seen in a movie, in a cartoon,
In MacGyver.
About cutting and sucking and tourniquets and everything, ice, electricity. So many things have been tried, but they've only been shown to either do nothing or cause more harm.
Right. Okay.
So the only known treatment, effective treatment for rattlesnake bite is AntiVenom.
Okay.
And the only place you can get that in the hospital. So anything you try to do before you get to the hospital just delays care.
Okay.
So we recommend you do nothing, anything, and truly nothing. It's whatever you have read outside of the word nothing, don't do it.
Okay. Well, I have also heard it said that if you run to get somewhere, your blood is circulating more and you're pushing the poison around your system more, so you have to try to be cool and like.
So that was a good example of the classic,
Big bunch of BS?
No, not entirely.
Okay.
It's the classic example of where it's easy to say, like stay calm,
Right, yeah,
and go to the hospital.
Right. Leave a burning building and remain calm.
Exactly. Right? That somebody's likely going to increase the pace, be stressed, their heart rate's going to kick in. The reasons for that is that while the venom may have been injected, and you increase your heart rate, you increase circulation, you increase the amount of venom that can kind of be circulated. That in and of itself is not so much of a problem, although we try to minimize it. The real idea and what's really common with our rattlesnakes is that local injury. And the reason why we almost do nothing, no tourniquets, no nothing, is the classic saying, the solution to pollution is dilution. We'd rather have a small amount of damage to a large area than a large amount of damage to a small area.
Okay.
So a lot of these first aids are designed to isolate the venom where it is and prevent it from going to the rest of the body. And what you do is you create this pool of toxic venom sitting there and just digesting and eating away at stuff that you're more likely to result in like an amputation than you would be otherwise.
Okay.
Let healthcare take care of you, I guess.
It's a groundbreaking concept.
I know.
Is the rattlesnake the only poisonous snake that we have?
No, in the United States, there's the whole family of pit vipers, which includes rattlesnakes and water moccasins, as most people would traditionally think of them as rattlesnakes. Then there's coral snakes. And there are 3 different types of coral snakes in the U.S. There's the Sonoran coral snake that we have, the Texas coral snake, and then the eastern coral snake, which is predominantly the Florida area along the Gulf Coast, hugging the Gulf of Mexico. For Arizona, though, when we consider our coral snake, it's the not so dangerous of all the coral snakes. In fact, of all the coral snake bites that we've seen, which is a very low number, for one, our coral snake doesn't get very big.
Okay.
Its head might be the size of a pencil eraser. Their fangs are also pointed, they're like human fangs. They don't move, but they're also pointed backwards in their mouth. So for a tiny little snake to bite a human, it's usually from picking them up and handling them, and they might catch your finger just right.
Right.
But they don't necessarily inject enough venom to cause any problems. We've never seen anybody get terribly ill from coral snakes, so much so that we don't even stock AntiVenom for coral snakes in Arizona. So while we have it, it is venomous. We just haven't seen any problems with humans.
I tend to think a lot of people who get bit by snakes, I mean, certainly you can step back and step on one. I tend to think a lot of them are probably messing with the snake or trying to grab it, in which case, that's what happens.
Yes. Sometimes that will happen, and we've certainly seen that. We're actually doing research right now to try and look at our current kind of breakdown of who's being bit by a rattlesnake and what were the circumstances. We used to say a great percentage of them, more than 50%, were, we call them illegitimate bites, really people messing with them.
Right.
You recognized the snake, you saw it, you knew there was danger, but you went after it anyway.
Yeah.
But nowadays, what we're seeing, at least anecdotally, a lot more legitimate. So your average individual going out to the garden to pick a tomato or a zucchini and end up getting bit because the snake was in the garden.
Okay.
Or landscapers who are, almost an occupational thing. They're out picking weeds and they get bit because one was kind of disguised and well camouflaged where they were. Golfers, reaching your hand for a stray ball and you didn't see the snake in the shade and in the bush that you're reaching in. So we've seen quite a bit of shift where maybe it's more, we used to almost think 75% could have been prevented.
Okay.
Maybe it's more like 50%, but we don't know. We're doing some research right now to look into that. But it is true. There are plenty of situations, plenty of stories out there where somebody saw a snake in the middle of the road and wanted to help it out, decided to be the good Samaritan and move the snake off the road, gets bit by the snake, then kills the snake because it's angry at it, throws it in the back of the pickup truck, and then goes into the hospital. Oh, they were on their way home from the bar at the time.
Right, sure.
So those stories are plentiful.
Right.
And there's been situations where we've had a lady move a trash can, just the rolling trash can, picked it up, and she got bit 3 times on the wearing flip-flops before she could move out of the way. Or then you've got another good Samaritan golfer who has removed rattlesnakes from golf courses for years as if they needed any more assistance. But he reached down to grab one, to pick it up. It bit him, and his immediate reaction was to pull his hand back.
Oh, no.
And it kind of got caught on his ring a little bit. And when he flipped his arm back, the snake released and then hit his golfing buddy in the chest and bit him in the chest. Oh. So the Good Samaritan rule turned into 2 rattlesnake bite victims all of a sudden. So the circumstances behind the bite are usually interesting. And then the actual clinical course, the envenomation itself, usually runs its own spectrum.
Now, as awful as that story is, this turns out to be a pretty interesting day at work for you.
Absolutely, yes.
Tell me a little bit about the volume of calls that you get here.
At our poison center here in Tucson, for all 14 counties outside of Maricopa, we average about 140 calls a day. Wow. And those are incoming calls. A lot of our calls generate an outgoing call, because just because you called us doesn't mean we're done with you. We're the ones calling the hospital to help the hospital staff, the physicians, the pharmacists, and the nurses know how to take care of you, when to give antivenom, how much antivenom to give, when you're done giving antivenom, how you know the labs are correcting, when you know they're a problem, the basic interpretations. That's our specialty here at the Poison Center, and so that's what we do. In Arizona, between the 2 poison centers, while we average around 50,000 calls a year, the other poison's closer to 100,000 calls. Wow. So to give you an idea, there's a significant number of calls coming in, all of which we can handle. And so there should never be a reason for someone not to call the Poison Center. Okay. Whether it's you have a basic information question, or you're concerned somebody's been bit by something or ingested something or exposed to something, you can always call us.
And what is that number, by the way?
That number is 1-800-222-1222.
That number once again?
1-800-222-1222.
That's the rule of radio. You have to give it at least twice.
Absolutely.
Or it's one of those commercials where you have to give it 8 times, and
you can give it as a jingle. We can give it any way you want. It's there is a radio commercial going around the country with a jingle on it. 1-800-222-1222. It goes on.
Is there really? Yeah.
Oh, there is. Yeah, it goes on. I don't know the whole thing to recite it.
1-800-222-1222. 1-800-222-1222. If you think it might be poison, then the first thing you should do is call 1-800-222-1222.
Very good.
24 hours a day, 7 days a week, every day of the year.
And you guys, of course, we've been talking about venomous bites, but of course you guys deal with people who have ingested the wrong drugs, or people who have taken illicit drugs, all those kinds of things, right?
Yeah, so the poison centers in Arizona, the 2 of them, are made up of pharmacists, nurses, and physicians, all working together to answer these questions, to take care of these people, whether it's the exciting things for us, or what we call the sexy part of toxicology, which are these critters, these bites and stings, to the much more common, which is the medication exposures, the chemical exposures, adverse drug reactions, suicide attempts, those types of things. We're all here working together to help Arizona.
Well, I'm glad you're here. We're glad you're here.
I am ecstatic to be here.
Yeah.
I love this job.
Here it comes, it's coming to get you. The rattlesnake.
In fact, that's just part 1 of our conversation on creepy crawlies. Join us next week for scorpions, poisonous lizards, and tarantulas. Big fun, I promise. I'm TG LaFredo. Thanks for listening, and I'll catch you next Saturday at 11:30 a.m. with another edition of Focus on Your Health, right here on the K-Jazz Radio Network.